Good afternoon and welcome to the National Family Support Technical Assistance Center's office hours. I'm Gail Cormier, the Project Director of NFSTAC, the Family Center of Excellence. We are led by the National Federation of Families. The monthly office hours are designed with the family workforce in mind. Our series targets the family-run executive directors and family leaders. This first set does. NFSTAC wishes to support all of the family support workforce. In order to accomplish this, we will be hosting additional sets of series for other family support workforce staff as we continue along. Office Hours was developed as an outcome of the listening sessions we conducted last winter. They will be held the fourth Thursday of the month at this time. Before we start our interactive conversation today, I would like to go over a few housekeeping items. Today's conversation is being recorded. The recording and any additional resources will be uploaded to our NFSTAC website under the Events tab. If you have any technical difficulties, please type your comment and someone will be able to assist you. Our goal for office hours is to encourage a conversation between our guest presenters and all those in attendance. And at this point, this is a rebroadcast, so we will not have a question and answer period. However, we did in our original session, and I wrote down and recorded as many questions I could. So we're going to ask those questions again at the end. We do not offer CEU credits for our events, but you will receive a certificate of attendance after the survey is completed. I would like to thank SAMHSA for allowing us to share this information with you today, and thank you for joining us. At this time, I would like to introduce our speakers from Thrive Peer Recovery Services in Ohio, Brian Bayless, CEO and co-founder, Brandon Bayless, Clinical Director, and Emily Pastorius, Human Resource Director. And I will let Brandon and Emily tell you a little bit more about themselves as the presentation begins. Welcome.
Thank you, Gail. I really appreciate the time today to be able to re-record this and kind of share some information about our agency. And really review kind of where we are today and where we were maybe a few years ago. So as Gail mentioned, my name is Brandon Bayless. I am the clinical director here at Thrive Peer Support. By trade, I am an independently licensed clinician who has now taken over a role to oversee our clinical staff, as well as the rendering of our community-based peer support. Thrive Peer Recovery Services is the largest provider of peer services in the state of Ohio. The state of Ohio has 88 counties, and we have provided services in all of those 88 counties, and we will go further into how we render those services later in the presentation. Thrive is contracted with Medicaid and all the MCOs that are certified by the Ohio Department of Mental Health and Addiction Services. We provide type 84 and type 95 peer support. So that's mental health and substance use focused peer support. Thrive was formed in May 2018 through a combination of Thrive Behavioral Health as well as live peer support component of Ascent, which was provided in an emergency department in the Cleveland area. Since 2018, we've grown pretty large, from a staff of 6 to a staff of about 150, 100 of whom are certified peer recovery supporters. As Emily and I will review today, peer supporters who are really what have built our foundation, have really kind of created what we are today. Without their service and them using their lived experience, it would be very hard to develop the agency that we do have. We currently provide peer support to individuals in all 88 counties, as I mentioned before, and we are now in network with our first commercial insurance provider, which is Anthem, and we are rendering services via telehealth to our commercial market. Next slide, please. peer support services. So as we can see here, there's a lot here. When I think about peer support, I think about it as a three-tiered system. The first system the first thing we're talking about is what's out there for me. I may not know what resources are out there in my community. So those peer supporters can really identify what's out there, provide insight, provide education. And so that's the first step. The next step is to access. Whether or not I know that the resources are there, I might have barriers to be able to access said resources. And so what a peer supporter can do is physically be with somebody if they are doing in person, or if they are in telehealth, they can encourage, they can set goals with them to help access these resources. And then the final step is empowering somebody to independently access resources. When we are peers, what we are trying to do is foster independence. When we think of our three-step model of find resources, access resources, empower to independently access, our ultimate goal is you don't need us anymore. You've built a foundation that you feel comfortable to continue on in your life with natural supports and the access to the resources that you need in your community. As an example, I'll kind of use one of the interventions that we do with clients. So support network. We think about a support network in many different ways. We support all pathways to recovery. So from a purely substance use standpoint, we might think about Celebrate Recovery, AA, NA. We might think about Smart Recovery. And so what our peer supporters might do is educate somebody on what those support networks are. And then the next step being access. So they might say, let's try one of each of these meetings. And in the course of those meetings, they identify that I really relate to one of these. Once they start identifying what they relate to, what we are going to do is empower independence. Have you gotten numbers? Where's the bus line that's going to get you here regularly? Because ultimately we are a stopgap in someone's life, but we are empowering them to take everything else on in the future. But you can see a variety of interventions that we provide: relapse prevention, job interviewing, SMART goals, recovery workbooks, MAT referrals. For us, we do not have a plethora of resources within our agency. We really rely on our community partners to help us access those resources that are out there for our individuals. Next slide, please. Where are our peer supporters? So we mentioned that they're in 88 counties. Well, not all of our peer supporters are out in the community meeting our peers face to face. We do have a large portion of our staff in the community. Those individuals are rendering services with our peers outside of any facility. So they are meeting them where they're at physically, might be in the community, at libraries, or if they're in a county where we do not have a peer supporter physically there, we're meeting them in telehealth. We see a lot of our peers access telehealth as kind of a supplement to their the services that they're already receiving. So the community is really those individuals that are kind of on their long-term journey outside of a facility. A big part of our programming is our health systems. We see peers in the ER as well as the inpatient setting in the health systems. And when we're seeing them there, it's a very acute service because those individuals are coming into the ER for a specific need. And at that point, we are intervening with them and addressing their needs. We also see them within the jail setting. When I have reviewed and overseen some of these programs, the jail population seems to resonate with a lot of hopelessness. And so what our peer supporters are there is to render support or to provide support to these individuals and provide some hope so that when they do transition out, if recovery is part of their goal, they will continue on after release. We work with recovery housing. We see a lot of needs with a population of recovery housing that aren't necessarily addressed. They're providing a safe space to live. They're providing support groups, but access to basic needs, access to mental health providers are sometimes a gap for those individuals. And so we work regularly with recovery houses to ensure that we can be an extension of the work that they're already doing. MAT clinics, as mentioned before, we support all pathways to recovery, medically assisted treatment being one pathway to recovery. So we can help individuals access the resources, educate them on the resources, and ultimately set goals to make sure that they can regularly access those resources, as oftentimes with MAT, it's important to be consistent with accessing those services. Detox centers. I really think of detox centers as an extension of our ER program. That's where we're seeing most of our referrals going from the ER. So an individual comes in and identifies that there's an issue related to a substance use disorder. Our peer supporters go into their room without an agenda. They don't have any goal for the individual other than to share their story in the hope that potentially it connects for them to obtain something, to learn something from them. And oftentimes we're seeing a large amount of individuals really connect to that story and choose some form of treatment as a result. And then drug courts. Drug courts are a phenomenal partner for us. They really are supportive of seeing individuals find access to resources to sustain a life outside of the system. And so for drug courts, there's specific plans that individuals have to stay out of incarceration as an alternative to our incarceration. So we work with drug courts to ensure that we can support these individuals in accessing the goals, accessing the needs that they have that will hopefully keep them on the road to recovery. Next slide, please. Tracking our progress. As we've grown, the one thing that we know for certain is that we need to have outcomes. We have a lot of beautiful narratives. We have individuals who are able to get their first job, individuals who are able to reunite with their family, individuals who are able to sustain recovery for 3 months. These are all amazing narratives, but we know that all narratives need to be accompanied with data, and all data needs to be accompanied with narratives. And so that's been a really large focus of our agency within the last 2 years. So we'll break down our success with our ED program in the next slide. So we are connecting those members, those individuals in the ER with their needs. So Thrive ED had 3,400 referrals in 2021. And those individuals, 77% of them were connected to a continuing service. And so we discussed partnering with detoxes. We want our individuals to get their needs met by the agency that can provide the best care based on their individual needs. So you see a large part of those individuals, 2,600 of them choosing some form of treatment. That could be detox, outpatient, non-professional, meaning we're connecting you to a meeting, we're connecting you to AA, a support group. Medically assisted treatment being a portion of our puzzle, as well as inpatient, where we see individuals going somewhere for 30, 60, 90 days, and then ultimately transitioning out to a lower level of care, PHP, IOP, outpatient. Next slide, please. Thrive ED is currently in 23 hospital settings as this slide was developed. I believe we are in a few other hospitals, generally around the Cleveland area, but we do have a hospital in the Springfield area, which is Southwest Ohio, as well as in Columbus area, which is in Central Ohio. Some of the more noted hospital settings that we work in are the Cleveland Clinic, as well as University Hospitals, amongst a few others like Metro Hospital within the Cleveland area. So we've been fortunate to have wonderful partners in the hospital space, and what we kind of provide and what we see as being effective is they're stretched thin, especially during COVID-19. They've been really tasked with a lot more than their duty assigned. And so when it does come to what we believe we specialize in, substance use disorder within the ER, they do rely on us to ensure that their clients can get what they need, but also not to take away from resources from some of their other clients' needs. We really work on an integrated system of care. Ultimately, we are only as good as our community partners. We do provide service, we do provide connection, but really we have so many great community partners, and we rely on them to be the experts in their areas, as well as they rely on us to be the expert in our area, which is peer support. Person-centered approach. As a clinician, as an individual, it is so empowering for individuals to make their own decisions. Once they make their own decision, it's a lot easier for them to stay on the pathway to recovery because they've acknowledged what they want versus a provider coming in and telling them what they need. This is a big component of what we do is motivational interviewing, which is very person-centered. You make the decision, we'll support you on that decision and establish goals that will help you stay on the right track. Trusting relationship. I believe rapport is the foundation for good service. And so we really want to meet with our clients where they are at. We want to share our story and understand that we're in this together. We want to inspire hope for these individuals. As a positive note for the hospital system, this decreases emergency department visit time, total visits, and physical burnout by supporting linkage to additional support options. Once an individual identifies that there's a substance use disorder and they identify that they want to change that behavior, then we spring into action to connect to our community resources, our detox centers, our outpatient, inpatient. And what we do is we take it from there. The hospital has provided stabilization or whatever needs the individual has met from a physical standpoint, and we work on that long-term journey, which is that recovery. Next slide, please. This is really exciting, seeing a steady growth. The number is really special, but what that number means is this is number of individuals that we provide services to. We've seen a steady growth from 2018. We've seen 272 peers, 2019, 1,700 peers, 2020, 2,700, and then 2021, I believe we exceeded that 3,036 mark, but we're somewhere in that range. One thing that we see from 2010 to 2020, or I'm sorry, 2020 to 2021 is not a huge leap in numbers of individuals served. But what we did during that time is really enhance our services. Employment has been a challenge for us, but we know it's not unique to us as an agency. But we took that time in 2020 to 2021 to make sure compliance was on track, to make sure that we're doing comprehensive treatment plans, to make sure that we're developing an interdisciplinary team. So although we don't see a large jump in numbers of individuals, we believe that the quality of service that we're rendering during those times has increased. Next slide, please. We try to make our process as seamless as possible. Our individuals, we know the stages of change. When a client is contemplative, you have sometimes minutes, sometimes seconds, when the individual is ready to start linking them to care. And that's why the ED is very unique. We're meeting them at a very vulnerable moment, and at times we can be that hope, that beacon of hope to connect them to services. So when we are talking about an intake, we're running them through kind of the entire process to ensure that they're getting their needs met in a timely fashion. Person is identified as a referral. We have referrals on our website. We also do take them by phone. It is sometimes easier on the website for individuals to just fill out this form. The referral is filled out, and we always welcome any information that someone wants to provide, as this helps with continuity of care. We want to work with our partners. We do not want to work against them. So any information shared is really valuable to that individual's recovery. Our referral goes to the intake coordinators, who verifies their benefits, their insurance, make sure that they're qualified. Referral is sent to clinical team to complete an assessment if needed and develop a treatment plan. We treat individuals with substance use disorder as well as mental health diagnosis. Therefore, we do a full comprehensive biopsychosocial assessment from a social worker or counselor. It's integral for us as individuals in this field to treat the entire individual. So we don't want to just treat the substance use disorder if there's underlying mental health, and vice versa. Then our community manager will assign a peer supporter based upon current caseload, geographical location, and gender of peer. The peer supporter reaches out to the peer to introduce themselves and build rapport. Peer services are provided. If we have access to the clients, if everyone answers the phone in the timely fashion, we could see a referral to services being rendered at about 3 to 5 days. And by services being rendered, I mean at least first contact with the peer supporter to the peer to at least establish their first face-to-face contact. Next slide, please. I believe this is where I turn it over to Emily.
It is. Thank you so much, Brandon, for the perfect intro. So unique challenges to employing peer supporters. So the vast majority of our employees are in recovery themselves. So we're always putting that at the forefront of all the decisions that we're making and everything that we do. We want to ensure a recovery supportive workplace and being flexible and making sure, reviewing all of our policies constantly and making sure that we're using non-stigmatizing language and making sure that our peer supporters recovery comes first. It's going to be very difficult for them to peer support others if they're not in a strong place in their recovery themselves. So we're always encouraging that self-care and really making sure our team is putting their recovery first and really trying to create the spaces conducive to that and to really make sure we are being supportive. I'm sure this is not news to anybody listening to this, but staffing shortages within the behavioral health field are rampant. I think we're all experiencing that and all dealing with it. So really constantly trying to think of new ideas and come up with unique ways to attract and then retain the staff that we do already have. We certainly have challenges in this field that some of the other industries don't have to experience or don't have to go through. So really trying to constantly be on the cutting edge, to be progressive, to always try and come up with ways to make sure that we have the best talent and the best team. One of those things that does come up within this field are the extensive background requirements. So we do require BCIs for our employees here in Ohio, and there's been staffing delays there and COVID and all of these things that impact that turnaround time. Whereas Home Depot, for example, you can apply and then start the very next day. And those are just it's not feasible within our industry. So we're always trying to make that process as efficient as we possibly can. We also want to assist our candidates through this process. If their background is ever prohibitive for them, we want to try to assist them. So that could be through a CQE, a certification of qualified employment, walking them through the expungement process, helping them and guide them as much as we can. So our recruiting process isn't necessarily just a pre-screen and done. There's times that we'll work with candidates over the course of months, really helping to bring awareness, to help them through all the different processes and really assist them in gaining employment with us or really just for the field as well in general. Next slide, please. So creative solutions to these challenges, we're all aware of the challenges and problems. So what are some solutions that we can come up with to meet those head on? So one thing that we've done that I think has just been wildly successful, and I'm just so proud of our team for all the work that they put into it, and that's the mentorship program. So our mentorship program, our team mentors are peer supporters themselves. They're more senior members of the team. They've been out there. They know the processes. They understand the unique challenges our peer supporters face. So they're in a leadership role, but not a supervisory role. So it takes some of that relationship and it allows it to be supportive and developmental without necessarily, having to have that supervisor manager type relationship. We do have a separate management structure for that. So this has really created such a cool community. And, Brandon and I have both had the pleasure of being on some of these meetings where the team just supports each other and uplifts each other and talks about the challenges that they're experiencing. And it's really created a safe space for our team to talk about these things and to support each other and create that community, even when we can't physically be in the same building or in the same office. Our peer supporters are spread all across the entire state. So this is really helpful and has been very helpful in building that. And just continuing support for all levels of the organization. So ongoing and training and development opportunities. We do have team members dedicated solely to training and providing these opportunities. So we have a really extensive orientation. It's a little bit more than a week generally. And then they begin the on-the-job training We have monthly in-service workshops. We offer out, our community partners will offer trainings all the time. We send those out constantly, and really making sure that people have the opportunities to continue to develop their own careers. Building the right infrastructure, making sure we have the right support for our teams in place. And then our employee assistance program, this was something that was really important for us to offer. This is an outside third party who can be there to support our team members. So anything going on in their personal lives, they have this outside unbiased third party who they can talk to at no cost to them. So we do provide this at no cost to our employees, and it's for them as well as any members of their household, which is we find to be really, really beneficial, especially during those difficult personal times. I do think these things have allowed us to continue our growth. When I started just over 2 years ago, we had just under 100 employees, I believe. And in this time, we've grown to up over 150. So we've had a lot of hiring, a lot of growth, and it's just a testament to our team's hard work and really trying to be creative with these solutions. Next slide, please. So important for success, again, that infrastructure, it's really important where you can to avoid staff burnout by making sure there's a strong infrastructure and a strong team in place. And it's not always possible. We mentioned those staffing shortages. Those are affecting all of us. So we absolutely do the best that we can, making sure that we provide really strong teammates and just creating that strong system of support. Culture is so, so important to us, and really another top priority when we're making decisions and thinking about what we're going to do for our team. So creating an environment where people want to be. The work we do is really, really serious. So I think it's so important that we have fun when we can. Last week, our team went to a whirly ball event and got a chance to unwind and get to hang out and just really connect as people. And that was so important. And we're still talking about it this week. So I think where you can have fun and you can unwind and you can decompress, it's so important, especially when you do such serious work that can really be difficult emotionally. And taking action when feedback is given. I think being nimble and adaptable in this environment and landscape is so important. Things are changing. The work landscape is not what it was 2 years ago. And I think continually listening to feedback, listening to your team, asking questions, and then adjusting where it makes sense is more important now than ever. I think change is here to stay. Change is definitely the only constant. And I just think it's important to remain flexible, remain nimble, and where it makes sense for your business to be adaptable and flexible. Next slide. So I think that concludes our slides. I don't know if we want to move into questions and answers.
There's a technical question. Are we all online, or is it just spotlighted? I can't see.
I believe we're all online now.
Oh, okay, great.
Brian has joined us as well.
Well, thank you, Brian, for joining us. And Emily and Brandon, that was great, and I appreciate it. I am going to ask some of the questions that we had, and I hope that you can answer it. But before I start, Brian, would you like to say anything before we begin with the questions, since we have this time and we appreciate you coming back?
Well, thank you. I just want to thank you so much for inviting me and us to speak and share this information, this really important information about peer support and how Thrive's working in the community. And we look forward to partnering with you and helping where we can.
Yeah, and we've been so impressed, our whole community has, with how Thrive has grown so fast from a fledgling company to this big organization that is employing a lot of people at the same time. So that's pretty impressive, and congratulations.
Thank you.
Okay, so we're going to repeat some of the questions that we had, and I don't know who answered them in the past, but feel free to bounce them around to whoever it seems reasonable. First question, what are your policy for those who identify as trans or non-binary? How do you determine the gender of the peer, and do you match them?
Yeah, so I think I took this one. So we are respectful of how people identify their gender. So for trans, non-binary, we're going to take that person's self-identification into consideration. So that goes for peers as well as our employees. We respect how people identify, and we have built our policies around that, and of course want to ensure everybody's comfortable in the situation and arrangement, but we are respectful in that regard.
Do you employ family peer support and youth peer support, and are the trainings the same?
That's something that we're working and we're really building. In the state of Ohio, they have just changed the definition to recognize family and youth peer support. So we are really excited. Our whole team's kind of working tirelessly to ensure that we can transition from using our similar model. We talked about the, find the resources, access the resources, independently access them, to meet the individual needs of the family and the children. In my past experience, individuals have under 18 have specific needs, and we're really treating that whole system. So we want to make sure as we're developing this program that we really aren't missing out on anything that's really important when you're rendering services. But that's something we're in the development process. We have worked with transitional age youth at 18 to 21, but it started in 2022. It's a big focus for us as an agency.
Mm-hmm. And I actually think I answered the next one, but we'll see. Are foster parents eligible to be family peer specialist? And I can answer that. If a foster parent has, it depends on your state, and some say you have to have legal caregiver and guardian rights. So it really depends on your own state. However, in essence, if a foster care parent has had experience navigating the system with the individual that they consider their child, even for a limited period of time, yes, that foster parent could be a family peer specialist. Anything else?
No.
Could you speak to your Medicaid funding, hourly rate or waiver or something else? Could you also speak to the scope of documentation required from peer supporters?
Yeah, I'll take that. So we do have an hourly rate that is workable for us in the state of Ohio with Medicaid. The challenge is some of the other states that we're looking at. There are many states that don't pay a high enough rate to be able to support a system, a program like Thrive Peer Support. So that's a real challenge for us. But there are other states that we're going to be going into that do have a sufficient rate to pay for the service. In terms of the documentation, Brandon, do you want to take that, please?
Yes. So as mentioned before, really Thrive has been built off of the hard work that we've done in the community. And as an agency, we really recognize the professionalism and that an individual who renders peer support services is a provider. So the state recognizes that, documentation is required. But what we've taken is a unique lens where we've taken some of the experience from the clinical team, myself and others, and said, let's ensure that documentation is kind of up to par with those other providers, because we believe the future of peer support is really integrated into those teams with social workers, doctors, case managers. And we believe if our documentation is up to the standards of those, it will help kind of integrate into those systems easier. And so I believe our expectation of our peer support kind of exceeds a little bit what we are expected in the community, but we continually look at that to make sure that it's kind of meeting the needs of the individual. So you might see a peer supporter write a note that says, peer is in the action stage as evidenced by attending meetings regularly weekly. That for us is really important because they're learning that language, it's enhancing their practice, and we really want to elevate what a peer supporter is viewed as in the state of Ohio as well as across the country.
And are peer supporters supervised by other peers or by clinicians or by both? And I personally know that it varies from state to state for family peer specialists.
At our agency, our peer supporters are supervised directly by peer supporters with the supervisory distinction. They have to take an additional training to be a peer support supervisor and have a certain amount of experience. We also, we really focus on kind of talking about clinical backing because we do integrate into this model, this interdisciplinary team model, that all peer supporters have access to clinicians in our organization. So if there's something that they run up against that they're not familiar with, they're uncomfortable with, they don't know what that diagnosis means, we always have clinicians available to be able to consult to make sure that our peers are getting the services that they need and that our peer supporters feel comfortable in providing those services. So it's kind of a combination. More formal supervision is done by a peer supporter, and that's weekly. And then less formal is, you know, we're always available in the background to make sure that our clients are getting what they need.
And I know, Emily, you addressed this, but there was a question. I'm just going to repeat it anyways. How are you addressing background checks and barrier crimes? How do you advocate for those with nonviolent histories overcome this barrier? And can you explain a little bit more about CQE?
Yeah, absolutely. So when it comes to assisting candidates with their backgrounds, we really try to focus on assisting them and providing them with resources within their community. So for example, up here in Northeast Ohio, Case Western University Law School offers free legal resources to the community. So we can connect them with that resource. And really help walk them through the process. A CQE is something where the court provides, you know, they'll go through hearings, they'll sit before a judge, and the court will decide and basically provide an exemption on that charge. So allowing the person to work in spite of this charge that they have on their record. So it's sort of backing them in being able to proceed with employment, even though they have something on their record. And really just connecting and working with them as much as we can, just being supportive because it can be stressful and it can be a lot, and having to sit in front of a judge is incredibly stressful. Now, if a candidate is at the right part of their recovery journey, you know, maybe it makes sense for them to be a peer, and this is something that their peer supporter can assist them with as well. So really just try, depending on an individual situation, just help them as much as we can. But each situation is going to be unique depending on the individual, the charge, and what kind of employment they are seeking.
One thing that I know we addressed, and Emily, if you don't mind, we talked about interviewing individuals and sharing lived experience during that interview process. Can you talk a little bit about that?
Yeah, I'm not sure if Gail has this one on her list of questions, but I do know that this was a hot topic, and that was about asking peer supporters about their lived experience through the interview process. So from an HR standpoint, this is absolutely something we can do. In HR speak, it's called bona fide occupational qualification. So what that means is you know, if something is a requirement of a job, you are absolutely able to inquire about it, talk about it, and include it as part of the job description and a requirement of the job. So that can include lived experience. Back in my HR school days, you know, the example that we'll use is a firefighter. So a firefighter is required to be able to carry a certain amount of weight. That's a requirement of the job. You need to be able to do that task in order to have that job. However, an accounting position probably doesn't need to be able to lift that kind of weight that maybe a firefighter would. So you don't want a blanket requirement something for all jobs. You want to make sure it makes sense for the job that you're doing. But peer support is all about lived experience, and it's all about sharing that story. So it isn't a bigger requirement. So from an HR standpoint, you are absolutely able to ask about that. And I would encourage you to ask about that because it is such an important part of this position and of this job.
And you could put it in the job ad too?
Yep, you can put it in the job posting, in the job description. It is a requirement to be a peer supporter to have that lived experience. It's so important.
That was my next question, Brandon. So thank you. And the last question we had were, what are a couple of key questions to ask in an interview?
Yeah, so I think asking number one, tell me about your lived experience. And I think it depends. So for family specifically, tell me about your lived experience of navigating the systems, or tell me about, what it was like to navigate the public school system. What kind of challenges did you experience when you did that? What resources are available in your community to help navigate those systems? Those kinds of questions, you'll really start to get that experience and, what did they do? How can they articulate their story? And how connected are they within the community? And the more connected somebody is, the more value they're going to be able to bring your organization. So I think those are all, there's a lot of different ways you can kind of word, but really get to a similar point. But you really want to base it on the position, on what you're looking for out of that individual. But I think as much information as you can get about their lived experience and their connections and their knowledge of the community and the resources available are all really important things to ask about.
Well, thank you. This has been a fabulous conversation again, and I really appreciate you coming back and volunteering to record this. I think that the community, our family-run community, is very thankful that you were able to do this. And I know for a fact that folks got a lot of helpful information from here during the original session. And I hope by listening to this again, they have some more really good information.